The doctor becomes the patient, and I get my own bladder makeover, my own botulinum toxin, or aka BOTOX bladder injection this morning for my overactive bladder. So excited for you guys to come along. The doctor becomes the patient, and I get my own bladder makeover, my own botulinum toxin, or aka BOTOX bladder injection this morning for my overactive bladder. So excited for you guys to come along. Excited, but first I have to head to my own patients and take care of them. Interestingly, I'm doing BOTOX on a patient of mine this morning first. I told her that we're both getting BOTOX in our bladder for the first time. She thought that was wonderful. And then after that, I get to head and get my own. Yes. Okay, so botulinum toxin, aka BOTOX. BOTOX is just a brand. Botulinum toxin for the bladder is intended for overactive bladder or urgency leakage. Overactive bladder is, I gotta go. Okay, my bladder, when it needs to go, it's got to go quickly, and I may have leaks because of it. I may have accidents. It's also FDA approved for neurogenic bladder. That's basically an overactive bladder patient that has a neurologic reason, like multiple sclerosis or Parkinson's or spina bifida. It is meant ideally in the scenario where you've tried something else. You've tried at least one medication and it hasn't worked. So insurance doesn't usually cover this unless you have failed one medication, because they want to see that you've tried other conservative options before going to this. And this is considered a third line option after trying pelvic floor exercises or behavioral fluid changes and one or two medications. So I have done these things. I have tried pelvic floor exercises. I have tried 4 medications. Not 1, not 2, 3, not 4 different medications, and still have unsatisfactory control of my overactive bladder. And honestly, I should have had this done probably a couple years ago, and I'm now taking control of my own bladder health, practicing what I preach, so I'm getting it done.
Yeah, I'm excited for school, but I wish I had started already.
Oh my God, I forgot. I gotta take my antibiotic. Yeah. Now or before. Sorry, I'm gonna take it. 1 pill. Ugh, I hate antibiotics. Ugh, so big. Okay.
What's that for?
It helps to reduce the risk of a bladder infection after this procedure, because we're poking holes in the bladder, sticking it with needles. Not poking holes, I shouldn't say it like that, but sticking the bladder with needles. No holes. Sticking it with needles because we have to inject BOTOX. And so there's an increased risk of bladder infection. And so this helps to decrease the risk. So my urologist wants me to take 1 tablet 1 hour prior to the procedure. So that is what I'm doing, following directions. Although it's 45 minutes, but don't tell her.
You've dealt with holes though before.
Yeah, I don't want to do it. We don't want to do holes. Okay? No holes. Okay, so botulinum toxin works by temporarily paralyzing muscle by blocking the release of this neurotransmitter acetylcholine at the neuromuscular junction. And since the bladder is a muscle, this works by basically decreasing bladder muscle contractility that helps to reduce urgency and urge leakage and frequency. I finally had enough when I was on vacation with my husband celebrating his birthday, and we were having a fabulous couples massage. And I had just peed before we went in to get this massage. And with like 40 minutes into the massage, I found myself having to really have to go. And I was trying to hold it. And I said, you know what? If I hold it to the end of this massage, I'm going to piss my pants. So I finally had enough when I had to get up from the massage and go to the bathroom. So I wouldn't piss on the bed.
because I had to pee that bad. And I really tried to hold it to like get through the rest of the massage because it felt so good. And I had to get up off the damn massage table naked and grab a towel and go to the bathroom. That was my like WTF moment, my fed up moment. And I know better because I do this. I knew better than anybody that I did not have to put up with this.
So this is how it is performed. Everybody always asks, like, how is this done? It's done through your urethra, where you pee out of your pee hole. Okay, and it's done through a instrument that we call a cystoscope. Cystoscope is a camera that we insert inside the urethra, and that is the camera that she is holding. And through that cystoscope, we can insert a very long needle. That very long needle then goes out through the end. Yes. And that long needle, see, she's putting the needle in. She does that before we even enter into the patient, so that it minimizes like discomfort and the time that she's in my bladder. And then through that needle, she's going to inject the botulinum toxin. Once she gets started, it usually takes, what do you think, 5 minutes? 10 minutes? Or less than that. Okay, yay, that's the answer I wanted. Thank you. All done. Took about 2-3 minutes. From a scale of 0 to 10, as far as pain, it's probably a 5. At least it was quick. And if it works, I'm happy to do it again and go through it because it's very quick. I'm about to get dressed and be on with the rest of my day. So,
Are you excited to leave those days behind?
I'm very excited. Things I will not miss. Rushing to the bathroom, almost pissing my pants.
So is it normal for women to experience that, especially after childbirth?
Yes, but the misconception is that it's just women and it's just after childbirth. It is very common in old, young, women, men. It is an equal opportunity. Overactive bladder does not discriminate. I won't know if this works immediately. It takes at least 2 days for botulinum toxin to kick in, and I tell patients up to 2 weeks. Doctor just texted me how I'm doing. I'm telling her my bladder is like WTF. Good morning. Tyler's with me, so don't say anything inappropriate. I just got my BOTOX done in my bladder.
Oh, okay. Good. How long will it last?
Like, hopefully it lasts 6 months.
All right. Well, I'm happy for you.
Thank you. I'm happy for myself.
All right. I'll talk to you.
Okay, love you. Bye. So it's been 5 days since my bladder Botox injection, and I have definitely noticed less overall frequency over the last 2 to 3 days. Actually, the first thing I noticed was my stream was slower. It takes longer to completely empty, which is fine. I can be patient. The frequency has slowed down. Still waiting on the urgency to decrease more. So I'll keep you guys up to date, but I am still optimistic. So it has been about a month since my bladder Botox, and I gotta say that it took a little bit longer than I expected to kick in, but when it kicked in, I have noticed a significant difference. I am going less often, and I have better control. I'm able to better control the urge. I would say from a scale of 0 to 100% improved, I am about 70% improved, which is really good news. It's not perfect, but I'll take it. It is by far better improvement than I have experienced with the medications I've tried so far.